What's going on, pre-Cairo students? This is Dr. Ben again with another relevant conversation. Someone who's recently graduated in the last couple of years, Dr. John Caruso, is going to shed some light on the process that he went through in the path. Dr. John, can you get us started by just sharing what you were up to before chiropractic school, what attracted you to becoming a chiropractor, and what that pivot point, where you were at, and what was going on in your life when you decided?
Yeah. So went to undergrad in Denton, University of North Texas. My degree was in kinesiology, so I knew I wanted to be in human performance, sports science type field. Learned very quickly that a bachelor's in kinesiology really just sets you up to go get a master's and then into research, and there's no real direction there. So very early on, I was like really interested in the physical therapy route. I had done physical therapy just from some sports injuries with football, and it seemed to help. And I was like, oh, okay, I'd love to help people out doing that, and it's with the human body, so it's really interesting to me. Um, During all of that time, I had been competitive in powerlifting at like a national, international, world level. Um, did that for like 10 or so years from when I was like 14 to 25 or so. Um, and during that time, like transitioning from high school to college, I was, of course, 18, resilient, bulletproof, doing all of the things, partying, hanging out, had a girlfriend, also training like a maniac. And that led to like some serious back stuff. Had some pretty bad disc issues in my back, which led me down a pretty dark path of like substance abuse, drugs, things along the lines of that, just to kind of like survive, not necessarily thrive. Um, Tried everything that you could possibly think of: acupuncture, physical therapy, all stretching, all literally all the things, and nothing worked. Nothing helped. Um, Went to a chiropractor, and like looking back at it too, and what I know now about like the skill level of adjusting. Like she was a recent grad at the time, um, and yeah, she was a recent grad at the time, and she was also like 8.5 months pregnant. So I felt like her level of skill as well as like she could show up, like we just didn't match, like a patient to doctor situation. And so of course I walked away from that situation. I was like, oh, chiropractic didn't work. um, but anyways, like I said, kind of like spiraling down a path of substance abuse and drugs and prescription drugs and all of the things. Went to a medical doctor, and they were like, we can give you drugs, and if in 6 months like that doesn't work, we'll schedule you for like an ortho consult for surgery. And so me being like 18, full of like rage, piss, and vinegar, was just like no, and got very angry and said some things that I wouldn't say today, and was asked to leave. And so that kind of like started the journey of like trying to find other things. At the time, my mom was seeing a chiropractor, and my sisters and my brother had been in like a car accident, and they were seeing a chiropractor, and they were like, hey, since you're gonna be home for the summer, first year of college, this is 2012, um, why don't you give it a shot? Like actually get some consistent care, and I'll even pay for it while you're home. So I was like, okay. Um, Went under care. Um, pretty intensive at the beginning. Like I think we started at like 3 to 4 times a week at the beginning, and then tapered off slowly. And I respond really well to care, anyways. Um, it was really fascinating that like he could work with my body and understood my body to the point that like he knew what I was going through and what it was going to take to get me where I wanted to go.
Mm-hmm.
It wasn't until like my like first trimester of college that I realized how big of an impact that was. All I knew at the time was I had got out of pain. I can continue to train and like go on that route of powerlifting like at a competitive level. I didn't realize that had I have not found chiropractic, that I would have been a failed back surgery and then been on even more drugs and like completely had like this negative downward spiral. Um, so that's kind of like how I found chiropractic or chose chiropractic. There were a series of events leading up to the opportunity to choose chiropractic, and I absolutely took it.
Is it safe for me to say that as a kinesiology student interested in exercise science who's disciplined enough to do powerlifting at a national level, that you're perfectly positioned to potentially become a great chiropractor because you have the discipline, the focus, the body awareness, and the interest in studying human movement, and that these series of events that took place in your life, you could say they happen for a reason. You could say that like it all was supposed to be this way, but there was a great chance that you would have never found chiropractic if you hadn't been so curious and in search of the answers, and that you might not have ever become a chiropractor, which it sounds like, judging by that sign behind your head right there, you're having the time of your life and really enjoying the process and enjoying the journey. Can you speak to what it was like to be a kinesiology student, what the culture was like on your campus, and why chiropractic was not present and represented there? Not why, but just like knowing what you know now and having the perspective you have now, like how would that have changed the student culture having chiropractic, maybe a pre-chiro club available as an outlet for you to explore, being that kinesiology degrees don't really get you much.
So, like I mentioned, I was really interested in like biomechanics and physiology and anatomy and human performance. And so my undergrad experience gave me that, but at a superficial level. Um, Actually, like while I was in undergrad, I want to say it was like my sophomore or my junior year, there was three of us that had actually started a pre-chiropractic club on campus. Um, One of the girls, her name's Deanna Allegar. She practices in Colorado, and the other female, her name's Leah Garcia. She practices, I believe here in Texas as well. And they actually graduated about a year and a half to 2 years before I did at Parker. So starting or actually even having like a pre-chiropractic club on campus was very, very eye-opening because we were able to like speak with chiropractors in the area. We were able to have like um, let's say like a better tour like around campuses and things like that. Um, Rather than like a prospective student, like you get to ask deeper questions and actually get deeper answers through that. um, Plus, like because chiropractic seems to be a very wide open field for the most part, like you can get a lot of opinions and a lot of information and a lot of different like areas or disciplines of chiropractic through all of that.
hmm Did you market the club while you were on campus? How did you really improve the awareness amongst your fellow students?
So students were very receptive to the pre-chiropractic club just because it was more information than what they were already getting. Additionally, like there's like a pre-PT club, and I think there's something like an occupational therapy club or something like that. Basically, like any of those disciplines that a bachelor's degree or bachelor's in science kind of sets you up for, there was one. Um, we always marketed like events where we were having docs come to us, or if we were going to go to a doc, or if we were going to go to a school, um, as well as I believe we like had like some textbooks, and like we're just like having like group discussions on like chiropractic books and stuff too. And of course, like we had flyers everywhere, T-shirts, and all of that. So people were really receptive and really excited to like learn more about it. And plus, in some of our like the preliminary or like the some of our core classes within the kinesiology program, we actually had a lot of like representatives from Parker, and I believe we also had some from Texas Chiropractic College down here in Houston, um, come up to the school and speak with us just in
hmm
classes. So
That's really cool. Do you think that having a pre-chiropractic club was really important to the other students, even though they didn't go to chiropractic school? Was it helpful in a way of helping them just know what chiropractic is, even if they go become physical therapists or go to a medical program, that they were gaining some level of exposure?
I definitely think any and all exposure for chiropractic is a good realm, especially in other disciplines, whether that be more medical or PT or whatever. Um, I didn't really have too many friends, or I don't really have too many friends that I still talk to today that went other routes. So I can't really say like how big of an influence that was to them moving forward. But I do know that like now the more providers that I talk to that are exposed to chiropractic, they're like, wow, I wish I would have known this like through school, especially because certain professions do kind of get indoctrinated a little bit as to what chiropractic is due to misperceptions and myths and all the things that everybody hears about.
No doubt. Can you talk about your student experience? What did you gravitate towards? What were you attracted to? What did you engage with? How did you um, have like your best experience having had that pre-Cairo experience? How did that help you have a better experience in school?
For me, to touch on like the powerlifting side, or at least like performance sports, like mindset was really big. So like that head down, hood up mentality, blinders on was like really big, and a influential like mindset to have throughout undergrad. Like once I like saw and understood like, oh, chiropractic like helped me massively. I'd love to be able to help other people the same way that it helped me. That was just like my laser focus of just like, okay, there's something that I can dive deeper into. Um, and there's people that want to teach it as well. Like there's other people that are as excited as I am wanting to learn about this, as well as there are people willing to pour into us that are wanting to join into the profession. But outside of that, like I really didn't do a whole much or like a whole lot. I went to classes. We met with the Pre-Chiro club. I would go to offices. I would try and talk chiropractic with people that I knew that were in chiropractic school, just because I would meet people like as I went on through undergrad and really just try to like get their experience, um, like through all of that. So I didn't really do a whole lot through school in terms of that. I was just active in the club and trying to meet people and docs in the area.
Right on. I was actually referencing chiropractic school, but
Oh,
I like
chiropractic
that.
school.
I
Oh,
like that
cool.
you gave the whole pre-Chiro student experience, and obviously you didn't do a whole
Oh
lot
man,
because there's not a lot of infrastructure for
yep,
pre-Chiro. Let me just touch on some of the things I think you could have done really briefly. You
sure,
could have started the pre-Chiro club in the context of it being a business and you
sure.
having to develop a small business plan on how you were going to reach some people and how you were going to make money and keep a budget or project out if we had this many members and what are some ways that we could make money, maybe charge to go to these offices or charge for different materials that you were creating for students. You could also have like compiled a bunch of different office observations and actually packaged them for pre-Cairo students so that you are not only collecting and organizing the information but also delivering it in a communicative type of way. But anyway, those are just two thoughts off the top of my head that
Yeah.
could have been creative projects. And obviously, when you're a senior as a kinesiology student, they encourage you to do some sort of independent study, some sort of capstone. You could have studied something in the realm of chiropractic that might have served you when you were going in. But yeah. Anyway,
Oh
just a
man.
thought.
So my chiropractic school experience was vastly different from my undergrad experience. I was more introverted during undergrad and in chiropractic school, like the kind of cliche, like, oh, like I found myself or stepped into my power, like chiropractic school changed me. Like that's like absolutely true for me. Um, there was a lot of adversity through chiropractic school and that like shaped my experience. But I really was drawn to the philosophy as well as the science of chiropractic, and that also drew me to being the best that I could be with my hands. So, learning to adjust early on was not necessarily super accepted by the school, but I did literally everything that I possibly could throughout my 3.5 years to learn as much as possible. If it's okay to get a little vulnerable as to like why I did that, I'd love to share it. Uh, in try one at Parker, because Parker does trimester schedules, other schools do quarter schedules, so 4 terms versus 3 terms within a school year. In trimester one, I signed up for my first seminar, like adjusting seminar, to get real hands on. There was an upper tri that came into our classroom, like real discreet, and was like, "Hey, there's this seminar. We got to keep it hush. Like, we could get in trouble." Like it was like a whole thing. But I was like, okay, like this is what I need to do. Like if I want to be great at this, this is the one thing that we do, and I want to do it well. And so I remember being so excited about it because the seminar was in like try two, so like a month or two later or something. And I remember going home, and at the time, like my mom was under some like pretty serious like health conditions, and so like I remember her talking. I was like, man, like I can't wait for you to like learn some of this stuff, to be able to like give me some relief and help me with what's going on and all of that. And so that was like so focused. I was so excited on going to the seminar and learning some stuff to help out my family and my mom and all of that. And like a week before I was supposed to come home, like in between that seminar and whatnot, I think it was like the week before Easter or something. So my mom actually passed away during try two, and so that was very hard for me in terms of like not being ready to serve her when she needed me. Uh, and that's a mindset that I've kept with me all along the school process, because at any moment someone else's person is gonna lie on my table, and I damn sure better be ready. So that was like my driving force to do seminars almost every weekend, to do palpation in between classes, to meet up with friends and learn things from upper tries and docs in the area, and literally get as much hands-on time as I possibly could, because I didn't want to be faced with an event or a situation where someone else was putting their loved one's life in my hands and I wasn't going to be ready.
And also, it sounds like you committed to being an extraordinary chiropractor. You wanted to be the best possible chiropractor that you could be. You weren't just trying to be a mediocre chiropractor that got through your classes, got good grades, did very little outside of the classroom in regards to practicing, and just jumped through all the hoops that the program gave you in thinking that it would prepare you uh, as best as it possibly could for the real world. But that's just not the case. Can you speak to the ratio? A lot of the times I like to think of things as, I was 10% in the academic part of the curriculum and 90% in the parallel extracurricular part of the
Mhm.
curriculum process. Um, is that accurate to say for you it was like 1090?
Yeah, I mean, I did well in school, like obviously the science part of things, or at least the bits and pieces of science of chiropractic that we got through school was really important to me. But doing well in school wasn't difficult for me. Like I could study well, I could grasp material well. It was also something that was like a part of a bigger picture that I was moving towards. So there wasn't a whole lot of resistance or friction through the school. It was something that I knew that I had to do to get to where I wanted to be. But yeah, that parallel as well as like the perpendicular curriculum to chiropractic school is incredibly important.
Mm-hmm.
The things that you learn outside are, I mean, more important, vastly more important than the things that I learned in school. Like
When you
things that
say
you learn in school.
perpendicular, do you mean things that intersect with the concepts that you're learning in the classroom that you've
Yep.
learned recently outside of the classroom?
Yep.
Aw-
Absolutely. Yeah.
Awesome.
That parallel curriculum keeps you grounded in terms of like things that are acceptable to help you get through school. But then there's things that absolutely aren't taught in school that are necessary to jump into practice. Like, for example, like since I'm new into practice and seeing people and communicating with people, like the business side of things was something we didn't get in school, and I would
Mhm.
consider that to be perpendicular to the curriculum of school. Communication, patient education, adjusting. Also, those things can be in that realm of like perpendicular curriculum, just because they either were like against the grain or just not what was being taught at Parker.
Mhm. What have been your biggest strengths entering into practice, and what have been some of the things that you recognize if you could have dedicated some more time or energy into developing yourself in those areas, you would have been better prepared to be like hit the ground running even more than you already were during practice?
I think that the confidence and certainty with my hands was a great strength, knowing that I don't like using the term like having a lot of tools in your toolbox just because I think it gets misconstrued in certain senses, but having a lot of techniques that like very very well within chiropractic, whether that be or basically adjusting techniques to pull from and utilize in different times with different people for different reasons, um, is one of my bigger strengths, knowing that, I can handle anything that lays on my table. Um, I think for me, um, one of my bigger struggles or weaknesses would be the communication piece. There were a lot of communication clubs that we had on campus. The club culture at Parker while I was there, before all of the quarantines and virtual learning and all of that, was phenomenal. So the exposure that we had to technique clubs and palpation clubs and science business, there was some business science clubs, communication clubs, all of that was phenomenal. And I was heavily involved with clubs on campus. But definitely the communication piece, as well as like understanding business. Those were, I think, two areas that if I had worked on a lot harder, and not just communicating with people within my class or within the school, communicating with friends or people at the gym, or like random people that like don't understand chiropractic, because the term, living within that chiropractic bubble gets thrown around a lot, especially when you're in school. You're talking to people that know what you're talking about. You get out here and you drop the word sacrum, and people are just like, "What's a sacrum?" It's like, well, okay, let's go back a little bit. But
Mm-hmm.
yeah,
Mm-hmm. Yeah.
communication in business.
Yeah. So, what are some of the questions that you're currently pondering in the communication realm in business, um, that are relevant to you right now today?
Making things as simple as possible, right?
Mm.
Because chiropractic is, or can be, as simple as it is complex, especially if we dive into philosophical concepts and diving into neurology and all of that, and understanding or allowing or helping people to understand like how intricately interconnected the body is, and like how people kind of like understand that like the spine and the nervous system is connected to all of these things that they may be experiencing. And so there's like that disconnect of like function and structure, and people get hung up on structure. So making things as absolutely simple as possible,
Mhm.
um, especially because like we see a lot of families, like the practice is 60 to 70% babies, like 1 to 3 years old. So it's like communicating things in terms of a baby,
Mhm.
is needs to be as simple as possible for moms to get it and dads to get it, and even for
Mhm.
little kiddos to get it.
Mhm. Totally. Were you starting your own practice out of school, or did you enter into someone else's practice?
No, so my wife's a chiropractor as well, and so because of where we wanted to go within our relationship and have kids and do all the things, like the added stressor of starting and building a practice was just not on the table in that timeline that we had. So I ended up joining her practice, and so we're in a group practice with another doc. She's the head owner, and we're just rocking and rolling.
Awesome. Awesome. What's that relationship like? How are they supportive? Not even on a personal level, maybe on a personal level, but also just on a professional level. How has it been helpful to enter into an already established practice and go from there?
For me, it's been a pretty smooth transition, just because like we spent quite a bit of time prior to graduation doing like training for like ins and outs of the office, paperwork, office flow, exam flow, report of findings, communication stuff as well. So it's actually been pretty seamless, and like the stuff that I'm into in terms of technique, as well as like my ideal avatar that I would love to see in practice, is not too far off from the avatar that's already being seen in this practice. So, like I said, it's mostly pediatrics, lots of prenatal and pregnant mamas, as well as family wellness. So we see dads and men as well. Um, so what I want to see, or who I want to see within chiropractic, is not far off and not too extreme from what's already being seen here. So there's less resistance and less friction moving in.
Awesome. Yeah. So the preparation you did beforehand, getting clear on who you wanted to see, allowed you to identify which office. Obviously, was easy because your wife is
Oh
already
yeah.
there. But in reality, the clearer you are on who you want to work with, and knowing the skill sets that you have and what they've prepared you for has allowed you to really it's great to hear you send that message that you've had a seamless transition from graduation into practice, because I don't think that's the norm. I don't think that's the typical, and it set you up for a really nice experience, which we want to see more of, right?
Yeah,
That's why we're doing this podcast. We want to see more of that.
exactly. And I would say that the work that I did leading up to like the clinical experience that I had in school was also helpful. Like I had quite a few classmates and knew other people within school that really struggled with the clinic experience. Getting people into the clinic to be able to meet numbers to hit graduation requirements was definitely a struggle for people. Um, Fortunately enough, that wasn't anything that I struggled with. I was able to communicate with people within the public as well as like effectively use social media to like reach more people. Um, and I had no issues meeting requirements. And so I did kind of um, have the mindset of like once I came into student clinic as well as like the outpatient clinic at school, that was like my first practice in a way. Putting the mentality on, it's like, okay, I'm not necessarily going to be making any money here. However, like what I'm gaining, the income or whatever, is going to be the degree at the end of the tunnel. So treating that as my first practice was really important as I approached the clinic experience.
Mm-hmm. Mm-hmm. Just looking back, the engagement you had in school, obviously things are different, but let's just assume they return to normal at some point, someday. What would you recommend to a student entering into school? Sort of, how do they sort of plan out or map out their 3 to 4 years that they're going to be spending in chiropractic school from a parallel and perpendicular curriculum standpoint?
Um, Something that I always talked about to a lot of my friends, and as well as like the younger tri students that were coming in that I helped teach or mentor or whatever through all of the club involvement at Parker.
Here,
Um,
just pause. Hold on one second.
yeah.
Just let it pass.
um, Exposure was the key there. So whether it was something that you wanted to do or whether it's something that you were on the fence about, like experiencing it or going to that seminar or learning that technique or adjustment or whatever, um, gave you more insight as to like if it was applicable to what you were trying to do as well as if it resonated with you. So like I had friends that would try to do more of like um, like some of the out there techniques or like some of the different things within chiropractic, and they would ask us like, well, did you like it? It's like, well, I'm not going to tell you if I liked it or I didn't like it because that's going to sway your opinion. And it's like you need to find out if you like it or not, because if you like it, that's great, you can use it. If you don't like it, that's even better, you don't have to use it. The insight on either side of the spectrum or either side of the fence is incredibly important.
Mm-hmm.
So what I did and what I always recommended for my friends and younger tri students that you've had on the podcast already, like Spencer Dupre, Ricardo Flores, Zach Thompson, Alex DiFrancesco, all of those guys. Something I absolutely recommended to them like early on was like go to as many clubs as you possibly can because it's usually taught by faculty. If faculty allows you to adjust and have clubs and do those things, or it's taught by older tri students like myself or the guys that I mentioned before that had done a lot of outside seminars and had learned a lot of things and were willing to teach more people to be more effective and to be greater docs and be better with their hands all throughout that process. Because like I said, we understood early on that the hands-on time that we got in school and the instruction through school it's just not enough.
Mm-hmm.
um,
If you were going to plug a couple of different seminars and plug a couple of different approaches,
yeah.
what were maybe 5 or 10 of the different things that really help support your process, and maybe why it helps support your process?
So I went to the depths of like KTC or Kairos training culture. So I did their level 1, 2, and 3. I did level 1 and 2 multiple times. Gave a pretty like solid understanding of like the biomechanics of adjusting and why you would adjust a certain way and how you would adjust things. MC2 was also a really big seminar for me in terms of analysis of knowing where to adjust, where not to adjust, as well as when to adjust. And the more that I dive into that, as well as upper cervical work, it makes more sense. Um, I feel as though like early on in my schooling, we adjusted way, way too much. And now I find myself adjusting very, very little on a daily office visit. So the certainty of knowing where and where not, when and when not to adjust was incredibly important. I feel like you only get that from an analysis. And MC2 seems to be the one that I utilize the most in the office. Some other seminars and things that I did a lot of cranial sacral work, and a lot of cranial work in general, just because it's massively important for the pediatric population as well as the adult population. Um, I also did, gosh, I did a lot.
Can you reflect on the cranial work, the cranial studies you did, studying the bones, the sutures, the mechanisms of the skull?
Yep. Um, I wanted to learn as much as I possibly could in terms of like adjusting techniques that we're all familiar with, or even people outside of the profession are familiar with. And I also wanted to learn more of the gentler, or low force or no force techniques that are available within the profession. And cranial work fit that just well, and it fit my avatar. So picking a technique or a technique system, or an adjusting technique that fit my avatar was really beneficial for that. Um, but yeah, the cranial bones are freely moving, especially in newborns and kiddos, and they facilitate a neurologic rhythm of cerebrospinal fluid, which acts as like a nutrient communication system as well as like a waste removal system for the nervous system. And it's incredibly important to facilitate communication between brain, body, and brain. Um, and that's one of the big reasons as to why I utilize that. So it was really interesting too, especially with like the intraoral stuff that we do with kiddos and palate work, how well that was actually influencing kiddos' nervous systems, as well as some of the issues with kiddos that we see with like cranial molding stuff or plagiocephaly or palate deviations and tongue ties and all of the things. It really was a massive learning opportunity to fit my avatar.
What are some resources out there that were helpful in you learning about cranial work?
So the first cranial seminar that I went to was called Craniosacral for Chiropractors by Dr. Eric Rubin. He also teaches some adjusting seminars like the Tao of Chiropractic, and I think there's also a seminar that he teaches BGI, which is biogeometric integration, which is just another model to utilize light force as well as more of the traditional chiropractic adjusting. Um, Another one that I've taken is with Dr. Martin Rosen. Used to teach within the ICPA, no longer teaches within the ICPA and does his own thing, and is very, very heavy in the SOT or sacral occipital technique realm, and teaches a ton of cranial technique stuff within like with a SOT lens. So I've taken one of his cranial courses. I'll be taking his pediatric cranial certification course here this year, just to further my knowledge about cranial work in general.
Yeah, drmartinrosen.com. He has all types of classes available that you can stream for a very reasonable cost. Some of them are $30, $40, $50. And he goes through the anatomy and physiology of the cranium and how it develops. Me having a newborn is super relevant to me, and the work that I've been doing on my newborn is translating to some of the kids that I see. And just better understanding the cranium is, I think, a very valuable tool, a very valuable, not tool, but a very valuable awareness to have, especially with humans that,
Absolutely.
yeah, that have
I
developed
feel like
distortion.
I feel like too, especially like with an analysis that we use, kind of like MC2, or having an analysis, whether it be MC2 or TRT or an upper cervical field analysis, or like Thompson, or any of those that actually have like analysis system within the technique system. Especially on these kiddos, what I find is that I don't necessarily have to adjust them as often or as frequent simply because of the cranial work that we do and how intricately the nervous system plays a role with the dural system. And we know that the dural system, or that fascial system that kind of like covers our muscles, as well as like the outer layer of the nervous system, is intricately related with the spine. So actually benefiting them from like not having to do as much as often has been really really interesting in practice.
Hmm. Hmm. What are some bigger ideas that you have now, having gone through the program recently? You have all this perspective. Where are some of the gaps that you might hope to fill one day, or that you would like to see filled within the professional education experience, or within just the profession at large? What's important to you, or what gets you juiced outside of practice?
Neurology, neurology, and the philosophy of chiropractic. I feel like we definitely had an amazing instructor that taught us the philosophy. That was a philosophy diplomate, which is one of the highest levels of professional certification that you can get within chiropractic in the realms of philosophy. So that kind of like that absolutely sparked my interest and drive and passion to learn more about the philosophy. Um, but a need or a lack or a void that could be filled is making it more relevant. Um, because I feel like some of the concepts within philosophy are very difficult to understand if you're not willing to put into the time, and also that it needs like a tangible component to it. And so something that I feel um, relates very, very well is understanding neurology, understanding how the brain receives and sends messages throughout the body. And once you get that, you can understand that these metaphysical concepts or these abstract concepts within philosophy aren't too far off from what science is already saying.
Hmm. Hmm. Can you build a bridge between a couple of concepts, whether it's adaptation and allostatic load, or whether it's epigenetics and the body is self-adapting, self-regulating, self-organizing?
Yeah. So we perceive our entire existence, we perceive our external world as well as our internal world by our nervous system. And it's the ability to adapt to forces or stressors, that being physical, chemical, or emotional. Um, the adaptation to those physical stressors is what allows us to continue to not only survive but also thrive. Um, and it's the inability to adapt to those stressors, right, physical, chemical, or emotional, that leads to interference or like a short circuit within the nervous system. And so that interference causes a disconnect between communication between brain and body, body and brain. So altering signals going to specific areas as well as information going into the brain. And if we're altering the perception of our internal environment or altering the perception of our external environment, we understand that the function of that will also be impacted, whether that be an organ, whether that be how we respond to a situation, how we can adapt to stress or maladapt to stress.
Hmm.
Um,
Hmm.
yeah, the understanding that our body utilizes all of the things around us, whether it be gravity, whether it be weather, whether it be the food that we eat. We understand that we have to adapt to those or assimilate or make those things of us in order to continue to survive. And I think that there's like that's a very simple concept when you think about it. It's like, oh wow. But then you also understand that too, the deeper ideas and concepts within neurology also says that. So the philosophy of chiropractic wasn't too far off from what people in neurology are speaking about now.
Hmm. Can you give some topics that people in neurology are speaking about now?
I think neuroplasticity is a huge topic going on right now. One of the definitions of neuroplasticity literally talks about hope in terms of the brain being able to adapt to information coming in and being able to rewire and fire to change neuronal synaptic circuits, or the ability for pathways within the brain to reconnect and connect and continue to fire and grow. And what's interesting too is that we see through Heidi Havik's work is that that's absolutely happening. Um, those changes, those neuroplastic changes are absolutely happening post adjustment. And also utilizing things within like a neurofunctional exam like we use here in the office, like heart rate variability or spinal thermography or surface EMG. We also understand that, hey, the adjustment is not just changing how people feel, it's really changing how well their nervous system is functioning. And I think that's been a really, really eye-opening thing, or eye-opening piece from a patient education standpoint.
Hmm. So what's possible then? What's the potential that we have as chiropractors to share that truth, to connect out further than previous generations have been able to connect out, because we now have social media. Obviously, there's tons of chiropractic adjusting videos on social media that are attracting people to chiropractic offices, but it's not just about the adjustment. You just talked about the philosophy. How can that really shift the consciousness of our communities? Like, what's possible with more chiropractors spreading that truth and also just reaching more people?
So similarly to like in school, like exposure was really, really awesome to expand people's understanding or awareness and what is uh, out there, as well as what is possible within the chiropractic education realm while in school. Additionally, like it's the same thing outside of it, where there's more exposure to chiropractic because of these things, and you can argue if it's good exposure or bad exposure. It's for your own uh, you to judge, really. Um, but it's exposure nonetheless, and it's interesting to see how massive social media has blown up, and how more and more people are hearing about chiropractic through marketing on social media, or even just people talking about chiropractic or showing chiropractic on social media. Um, the limiting thing is the science perspective, right? Is because there's not a ton of research, right? There's a lot of case studies and there's a lot of anecdote, or like um, this happened to me and chiropractic is great kind of a thing. There's just not a whole lot of solid research about these neurofunctional um, effects or results or things like of people coming to and leaving from a chiropractic office. So the exposure to um, the effects or how it's changing the nervous system, I think, is incredibly important moving forward, to be able to expand education and awareness and consciousness of those coming into or thinking about or on the fence about chiropractic, in terms of how it absolutely helps and moves towards like greater states of adaptability, leading to greater states of health, wellness, and life.
Hmm. Hmm. Yeah, I I'm right with you, and my question is always just like, what would it look like for us to build infrastructure to handle that influx? Because we don't have enough chiropractors. We don't have enough chiropractors that really can deliver that message through the adjustment either.
Yeah.
That's a whole nother piece. I see there's 5 people out there. If anyone has a question for Dr. John, I know Ricardo's out there saying my brother keeps spreading the truth. Lisa's out there showing you love. Lisa Tack. Anyway, the question remains is like, how can we build pre-Cairo on college campuses to share this truth with the educated people, with the guidance counselors, the administrators, the faculty members that are influencing that next generation, whether we realize it or not. There are disconnects between us and them. How do you feel pre-Cairo can make impacts or waves ripple through society if we have more chiropractors on health center campuses or on college campuses or high school campuses?
Yeah. Um, yeah, to continue to touch on that, like I think exposure is our biggest asset moving forward, right? The more people that see what chiropractic's doing, hear what chiropractic's doing, and the more people that actually get to experience it is what changes, right? It becomes that ripple effect downstream of just one person experiencing or even hearing or seeing about chiropractic, and that being a ripple effect moving forward and continuing to expand the awareness of others moving forward. Um, I do think that this is like an amazing opportunity. I wish that pre-Chiro was around like when I was in undergrad, because like that would have been like even more eye-opening for me. Even just the podcast game or realm in general, I don't think was like super prevalent, or at least I had no idea it even existed at that point. But like having outlets like this where there's docs in the field, there's students already in the process, there's people that are wanting to get into this to really gather as much information as they can to make informed decisions moving forward. Because that was exactly what we did at the pre-chiropractic club in undergrad. Was we were so ready and so willing and so wanting to learn as much as we possibly could that we were willing to go to whatever length it was, driving an hour and a half or 2 hours or whatever to some doc's office just to go hang out for an hour and learn more about his journey and his process and his recommendations or opinions or biases or whatever. So I think that having things like this, the exposure and how far reaching that things like this actually do play a role in like expanding chiropractic out into the public is absolutely necessary. So having more things like pre-chiro, having more clubs on like undergraduate classes or undergraduate campuses, having docs specifically like come on here and talk about their experience, their student experience, what worked for them, what didn't work for them, what's working for them now in the office.
Mm-hmm.
Basically, the things that I know now were from docs telling me like what worked for them and what didn't work for them, and then being able to process all of that, put it into play, and if it worked for me, it didn't work for me, then I could also share that with other people. So I think just creating a absolutely massive network, just like you're in the process of doing with pre-Chiro, at just like a much larger scale is absolutely necessary.
Mm-hmm. Yeah, I mean, you mentioned research. I've asked a bunch of researchers. I just had Deed Harrison on here. He's done 200 research papers. I had Christopher Kent on here. He's involved in a number of projects. And Christopher Kent was not as resistant to the idea of us needing more research or us needing more funding. He did lay out an agenda of what that research agenda could look like with an extra $100 million of injection into the profession.
Sure.
But Deed Harrison was like, "Hey man, we're making it happen. Let's keep moving forward. Let's keep charging forward." He was talking about, the $100,000 budget he's operating on allows him to publish 20 papers a year, which is unbelievable.
Whoa.
And it's really having that sort of sharp focus, that laser sharp focus. So anyway, it's interesting to present the research question and hear some pushback from people like, hey, we actually have enough research. We just need it organized, and we need the information to be presented, like you said, in a familiar way or in a way that people can relate to.
Well, in terms of the research too, it seems like the biggest lack is our own perceptions of other people outside of the profession looking at the research that's being presented. Like if you look at the ICPA certification or the diplomate process, like you actually have to produce some really in-depth case studies and whatnot for in order to get that certification. You have to put out a lot of case studies and research to be able to get that diplomate. There was someone else that does a lot of research. Matt McCoy with the McCoy Press or the McCoy Journal or the Annals of Vertebral Subluxation. They put out a ton of information and research all the time, whether it be case studies or research that's larger than that. We are producing a ton of research. There are a lot of things that are going on, right? The Havoc research, or Heidi Havoc putting out research, Bernadette Murphy putting out research. There's a lot going on. I just feel like the lack comes from our own perception of how we feel people outside of the profession are going to look at it, which is why you see that push for like, oh, we need more research. We need more research. The only thing is we're looking at it as like we need research that is deemed acceptable by those outside of the profession.
Are you gonna, it sounds like you're already in the process of getting that diplomat. Are you gonna contribute some sort of research? What's the process like from what you've learned? Can you shed some insights? Because I think that one of the limiting factors is our education doesn't teach us how to do research in our offices and our practices. Can you kind of shine a light on some things you've learned as of recent, how you'd go about doing something like that?
I know in the later stages of like the ICPA certification, or the CACCP is what it's referred to as. Um, you work heavily with a guy named Joel Alcantara, who helps with the research process. And so I haven't gotten to that step yet, but also understanding like, hey, what all is necessary to be able to put information together to produce a case report, is where I'm at right now. So understanding like how deeply we need to go with the intake process, how um, stringent we need to be on like the exam process, or like the things that we use, like the HRV, the thermography, or the surface EMG, being able to document those things frequent and often throughout care, as well as the subjective measures that people don't really like to use throughout that as well. That's incredibly important, and piecing all of those things together, to be able to uh, really solidify and produce great case reports that do give functional results, or functional conclusions to like specific pathology or conditions or whatnot that the research is really looking for. I mean, you can go on Google and like, can chiropractic help with, and a million hundred things pop up, and then within the research it's the same thing. Chiropractic and headaches, chiropractic and back pain, chiropractic and ADHD, anxiety, autism spectrum disorder. All of those things are neurofunctional conditions, or neurodiverse populations. There's just a lack of like, okay, there's one or two or a handful of these case reports or research studies out, but there's nothing that's massive out right
Mm-hmm,
now.
Yeah, I think they have what's called a practice-based research group or a
Yep.
research network.
PBRN. Yeah.
That's how they're doing it.
Yep.
Anyway, I want to thank you for sharing. I'm sure that we could keep talking and keep bringing up different topics that are of interest to prospective students. My focus is on being creative, being innovative, asking new questions, doing things differently than previous generations. It's up to us to really, I've heard it said, the first 100 years was really about establishing and solidifying the roots and the foundations. And now it's about like taking all of that and connecting it to the world and really building that bridge. And I think that pre-Chiro is just one of those bridges, and it's not mine. It doesn't belong to me. I would love it if more people created their own pre-Chiro channel, or their own pre-Chiro course, or their own pre-Chiro products or services. I'm really like, I'm needing there to be a couple thousand people that are actually developing and engaging and supporting the movement, so to speak. So I just appreciate the work you've done with the different people that we've had on the podcast. It sounds like you're doing some really influential things in their eyes to help clarify their path and help support them. And I think it's just so important. So thank you.
I agree, absolutely. Yeah, this is amazing. Wish I had some like an outlet like this when I was making those decisions to pursue chiropractic as a lifestyle and a career.
Mm-hmm.